we've been on this call, so I'm very glad that you all remembered to join us, and I hope you are all doing well. Molly is not able to be with us today, so we will not hear from her, but we will go ahead and get started. The first thing, as always, I want to give you all an opportunity to chat in any questions that you might have that you're hoping that we will discuss on the call, and we will do our best to get to them. So I'm going to go ahead and pause for a second and give you a chance to type in any questions that you might have in your chat box. Okay, well, if you have any that come up throughout the time together today, please just feel free to go ahead and use that chat box and chat them in, and we will do our best to get to them as we can. I want to start us off as always with the numbers, and so these are the numbers as of the most recent updates, which was yesterday for Vermont and Minnesota and Friday for Rhode Island. In Vermont, we are up to 1,715 people that have tested positive, and we're remaining steady at 58 fatalities, our last fatality being the end of July. In Minnesota, you are up to 90,000 people testing positive with 1,965 fatalities. And in Rhode Island, you're at 23,620 people testing positive with 1,088 fatalities. In the top right-hand corner, you can see our numbers from PHL. So it does look like this tab is starting to be used more frequently, which I very much appreciate. And as expected, you can see that just the larger numbers are coming in from Chittenden because it is more populated. Okay, perfect. Thank you, Kenneth. We do have some information for you on indoor groups. I did want to take the time, because it has been a while since we connected, and just show you some other statistics here. So worldwide, we have 30 million, almost 31 million confirmed cases globally. The information on the left is coming from John Hopkins, and so it says roughly 21.1 million people have recovered, with approximately 958,000 deaths. So we are fastly approaching 1 million deaths worldwide from COVID. In the United States, we have 6,748,925 confirmed cases, so almost 7 million confirmed cases, with roughly 3.71 million of those recovered, and we are fast approaching 200,000 deaths. The information on the right came from the CDC. So I'm sure that many of you know, but Dr. Fauci appeared with our Governor Phil Scott during a press conference last Tuesday here in Vermont. And I just have some of the quotes that he mentioned during that press conference that I wanted to share with you. He said, "I was sitting here listening to the numbers that Governor Scott said, and I would wonder if I could bottle that and take that with me when I go around talking to other parts of the country." And when he was addressing the impact of Vermont's population density on its cases, Dr. Fauci said, "It's not a question of density or not. It's a question of what you did or did not do correctly. And from the numbers that I've seen, Vermont has done it correctly." The question was posed to him, just are our numbers less because we're more rural, we're less densely populated? And basically what he was saying there is that it's not about that. There's other low density states that have not seen the same results that we have. So it's more about what we've done to address this and less about just our population as a whole. I lastly just wanted to say that he said, "At the same time that I'm giving you kudos to Vermont for doing so well, the message that I'd like all of the citizens of Vermont to hear is that this virus is a formidable foe. So please, you've done so well. Don't let your guard down. Let's everybody keep our guard up and not be complacent." So to kind of bring that point home, Casey does have some examples she wanted to share about other locations that were doing really, really well and then did have a bit of a change. So Casey?
Hi, everybody. This is Casey Durner, the health systems educator. And I wanted to to share a little bit of the research that I have done based especially on Hawaii that was mentioned in one of Governor Scott's press conferences a couple of weeks ago, that both Hawaii and Vermont were back in May and June doing super, super well, zero new cases every day. And Hawaii, like Vermont, had a very strict lockdown. They were one of the strictest in the country back in May. But Hawaii opened up more quickly and had a huge surge in cases to the point where they at some point over the summer, I think in August, were one of the least restrictive states and are now back in a full lockdown with, I think, over 10,000 cases. So Hawaii is an example of where we don't want to go, and also a clear example of how quickly it can happen. Dr. Levine also talked about the outbreak in Maine and how quickly cases spread from a single wedding that happened at the Big Moose Inn in Maine. And one wedding where guidelines weren't closely followed has now spread to over 125 cases and over 7 deaths related just from that one event. So Vermont is taking this very, very seriously and watching it very, very carefully. But that's why we all need to continue to be very vigilant. And there's lots of examples around the world of places where held up as an example of how to do it right, only to find a month or two later where things have fallen apart. So clearly we have a lot to celebrate in Vermont for how well things we have been doing, but also need to continue to be super cautious, as Dr. Fauci said. Go to the yes, and as Sabine mentioned in the chat, none of the deaths were actual wedding attendees. So it spread to somebody in the wedding who then brought it back to somebody else, either in a nursing home. I think there was one case in a jail. So those deaths were not actual wedding attendees, but in that main case, and it spread to other states as well. So it does happen very quickly. We've recently had a case here in Vermont at Killington with a small outbreak there. So it definitely something we need to watch and continue to be careful with. Let me see if there are any. Okay, you can go to the next slide, Melissa. Since it has been so long since we talked about or had one of these meetings, just a couple of things we've learned about COVID in the last month. Certainly, children can spread the virus. There was a lot of discussion about the role children have as we were talking about opening schools. Lots more research has come out over the last month about children's role in spreading the virus, and it's pretty clear that they can and they do, though they don't get as sick as adults. There's more and more evidence that bars and restaurants are big contributors to the spread. We're seeing a pretty significant decrease in cases around the country right now, and a lot of that is contributed to the closing of bars and restaurants in a lot of areas. As we move back indoors, that obviously is going to become a bigger issue. I know a lot, especially in Vermont, and I'm sure in Minnesota as well, being able to keep your restaurant open by eating outdoors it's been wonderful to be able to eat outside, but that is going to come to an end very rapidly here in the next couple of months. So definitely something to be concerned about. Dr. Fauci mentioned about a week ago in a news conference that they're now thinking 40 to 45% of people are asymptomatic, and there is definitely evidence that those people are still able to spread the virus. So certainly a huge concern. And Kenneth is pointing out, and I have that at the I have that about the CDC also, that the CDC is now saying that the virus is aerosolized, it is airborne. Not really a surprise to most people, but the CDC is now confirming that yes, it is airborne and it is aerosolized. That was today's news. As we know, COVID is disproportionately affecting people who are Black, Hispanic, Native people, and it's disproportionately affecting them medically. They get sicker. A lot more people are dying. It's also disproportionately affecting them economically. So huge impact on those populations. We're learning a lot more about the long-term effects of COVID, and certainly over the months to come, we're going to learn more and more about that. But long-term lung side effects, long-term kind of chronic fatigue-like symptoms, cardiac issues. So lots to be concerned about, especially in younger people who may have long-term complications to their health, and a lot more to come on that, I'm sure. There's now been 4 confirmed cases of reinfection, and there's been a lot of evidence that that happens over the last several months, but these are laboratory confirmed cases. So somebody tested positive for the virus, and they happen to also have the kind of testing where they were able to identify the exact strain. And yet these are worldwide. There's been 1 confirmed reinfection case in the United States, a young person in Nevada. I think he's 25. So they were able to get tested, and they identified the strain of the virus, and then they were tested again and confirmed to be virus-free. A month or 2 later, got sick again or got tested again and had a different strain of the virus. So a clear reinfection. This is obviously something we're watching, or the health departments around the world are watching really, really carefully. It certainly affects vaccine development and how often and how effective a vaccine will be if we can get reinfected by the same virus a couple of months later. So lots to watch there and lots to learn there. In 3 of those cases, they had a much milder illness the second time. The one case in Nevada, which was a 25-year-old, was sicker the second time when he got the virus. So lots to be learned about that. And again, even though we've only been dealing with this virus for 6 months, in the terms of an illness, it's a very short period of time. So a lot more will be coming out about that. Also this week, the CDC has again changed their guidance on testing. They've changed the guidance back to recommending that people with possible exposure should get tested. I think most states didn't adopt the last change, which was saying if you don't have symptoms, you probably don't need a test. But they have reversed that under a lot of pressure from the public health doctors and many other organizations asking them to reverse that policy, which they did this week. So everybody should get a test who has a possible exposure, or certainly anyone who has symptoms as well. I don't think I missed any chats, but just on.
Nope, you got them all, Stacey.
Okay, great. Okay. I did want to make you aware the American Heart Association has a public service campaign, Don't Die of Doubt, really encouraging people to seek care for emergencies, especially heart attack and stroke. This was triggered by, as we've talked about on these calls before, a real decrease in the number of people seeking emergency room care. So there are some short little 3-minute videos on the importance of still going to the emergency room if you have chest pain or if you have signs and symptoms of a stroke. So something you can share with your participants or talk about with your participants. They have some posters, and they have these short little videos. So please share those. Encourage our folks to be going to their doctor and certainly going to the ER if needed. Next slide. I want to credit this slide to Dr. Levine. Also, he did a webinar as part of the COPD and Asthma Learning Collaborative last week. And we shared some of this information for Louisiana about a month ago. This is the Vermont data on outbreaks and where they have been. As we are well aware, there's been the long-term care facilities. That's the second one there, LTCF. There's been well-publicized outbreaks in the long-term care facilities in Vermont. I was kind of surprised by how many outbreaks there were in workplace settings. Certainly, we are aware that medical and dental practices were a concern early on, but there's been 2 outbreaks connected with that, 2 in a child care facility as well. So this was interesting to me that they're both tracking it and then sharing it. These are pretty small numbers when you think about that only 27% of the COVID-19 cases in Vermont were actually associated with an outbreak. So a lot of it has been community spread. Next slide, Melissa. Melissa, I think you were going to talk to this in the next one.
Yeah, so basically these are just some of the things that have been on our mind lately, and I'd love if you want to chat in answers to any of these, that's great, but just so you know sort of where we've been thinking and sort of what's prompted some of the next slides coming in, just how are things working in your panel right now? How are you planning to transition to more inside work as it gets colder? Flu shots, we'll talk about that a little bit later, and then what do you need for support over the next few months? Basically, how can we help you? And so understanding that that's sort of where our thinking has been, we've come up with a few things that we wanted to share with you. And the first one is indoor group activity policy for SASH sites. So I just want to give a big shout out to the team leaders at Cathedral Square and thank you for allowing us to share this sample. You created this indoor group activity policy, and also thank you, MJ, for getting this started. I know that this was something that you worked really hard on, so thank you for that as well. If this isn't already on STAR, we can get it added after today for people to reference as you start to consider indoor group programming at your sites. If you've already created your own policy though, please send it my way. I'd be happy to just compile all of them on STAR so that we can share ideas that we've all had. But basically you'll see that as you go through this document, it just talks about things you might expect, but it's really, really helpful to have it all in one place. So here they talk about group space, limiting the amount of people and not to exceed more than 10, regardless of the size of the space. Masks are required, as is maintaining physical distance. They'll be offering repeats of the same activity to accommodate people beyond 10 that were interested in attending. They're going to hopefully have the windows and doors open for proper ventilation, but they're not going to be using fans. Participants are going to be asked to sign up with the SASH coordinator, who will ask them the COVID screening questions the day of the activity. No one that screens positive will be allowed to attend. The SASH coordinator will keep, and not positive for COVID, but positive for those symptoms. The SASH coordinator will keep an attendance log to help with tracing if needed. Also, all participants will be asked to notify the coordinator if they start to experience symptoms up to 5 days after the event, or if they're contacted by VDH contact tracers. So this will just be almost like a loop back to let people know, oh, I was at this event and now I'm not feeling well, or oh, I was at this event and now I've been contacted by VDH tracers. So that way everyone that was at the event can be contacted. They're going to mark off seats and all the surfaces will be sanitized after the event. Participants must disinfect their hands prior to the activity, and SASH staff must be in attendance for the activity in order for it to occur. And you can see on the right, they've even given some examples. This is on the bottom, but I couldn't fit it all on one page that way, so not so that you could read it anyway. But there's some examples of logistics for how to host the event, with the designated seating, all facing one direction, sanitization of equipment, etc. And so I think that this is the first sample that I've seen of an idea of a way to start some indoor group programming, and we wanted to get that shared with you all. It does look like we have some questions that have come in, so I will take a look. Oh, more comments about the aerosolized virus as a main culprit. Do we know the percentage of cases spread by touch remaining on surfaces versus aerosols? I don't know that. Casey, I'm not sure if that's something that you have at the top of your head.
I don't, and I don't think it's out. I don't think it's information that anyone knows. There's just more and more research that it probably primarily spread through the air and not as much on surfaces. We know from early on that the virus can live on surfaces for long periods of time. As you recall from the cruise ship there was virus living on surfaces for days. That doesn't necessarily mean it can be transmitted. So the newest things coming out is that most of the transmission is through aerosol, but really we just don't know yet.
Thank you. Kenneth expressed that he's very concerned about residents initiating activities or grouping once it gets cold. And I can let you know, Kenneth, that I was on a meeting this morning with the Cathedral Square Emergency Preparedness Team, and they also have those same concerns. So we are certainly thinking about that as well. Food, and there's a question, Casey, is food still considered a low risk transmission? Do we know about that?
I don't know. I believe Cathedral Square, we're still not doing any food-based activities that share food, mostly because there's just, when you're preparing food, there is so much opportunity to breathe on it. It's a little different than, sharing a ball or sharing a deck of cards, and it's put directly into our bodies. So I would certainly continue to encourage not doing potluck kind of activities or any food-based activities right now.
And then Jen Hunter mentioned that while food may be a low-risk transmission, you still have to take your mask off to eat it, which I think you were kind of alluding to earlier, Casey, with the bars and restaurants being kind of larger culprits for spread. And I do see Jen Schulmeyer ask the question too, is anyone talking about UV lighting for disinfection? Have you heard about that? I have not.
I haven't either. I know there is a lot of new stuff coming out, especially with schools, around different ways to decontaminate, but I don't know a lot about that.
Great, thank you. Melissa said that she has one SASH coordinator who's telling her that no group programming will happen until there is a vaccine. And then Annie mentioned that, is there any talk about setting up air ventilation in the buildings or common spaces? Not that I've heard yet, Annie, but it's probably something that is definitely being looked into or considered. And then I did just want to bring up this time right now to answer Kenneth's earlier question about guidance from Dale for indoor programming. I haven't, well, I take that back. I vaguely remember seeing some guidance for indoor programming a while back, and I can definitely share that if we haven't shared it already. But the thing that I've been hearing about the most recently is adult days reopening, and I know that there's some talk about that happening in the near future, but they are working through right now with Dale and the governor some questions around primarily transportation and food. So there will be more guidance coming out, especially around adult days, that I think we can draw from for indoor group programming as well. And is there a requirement or expectation around groups at this time? I think it really depends on which phase you're in and if this is something that you feel that you can do safely or not. I mean, I don't think that we have an expectation. We would just encourage you to consider your situation, and if you can, if this is something that you can do, to try it out and start small is what my best guess here is. You'll see the one thing that we are looking at right now is phase 4 in the phased-in approach talks about going to phase 4 when adult days reopen, which is why this is what's on my mind right now. And I honestly just think we need to look at that document again and maybe amend or update it, because the way phase 4 reads, it's sort of like everything's back to normal. We're looking at February 2020 in phase 4, and I'm not sure that we're there yet. So having tied that with adult days reopening, I think was our best guess, assuming that wouldn't happen until we were all able to just go back to normal. But now that it might be here, we're going to have to take a look at that document, and we will keep you all posted on what we can come to for changes. Sabina mentions, I would think that if you're in phase 3, it should be something that should at least be considered in regards to helping with social isolation. So this is talking about group programming. And I agree, Sabina. I mean, we want to keep moving forward with the program, with the model, in ways that it's safe to do so. So this might be those micro groups that Molly was talking about way back when, something, just to keep moving forward. Lots of comments coming in. I'm trying to get to them all. Do we have to get the go-ahead from team leaders before opening anything indoors? I would absolutely think that would be a good idea. And then Kim Russell says that she agrees. Sabina, our people need us. And Sabina said, yes, Annie. Oh, good, I got that one right. Sabina, submit a proposal to your team leader. So that's the policy at Cathedral Square. I'm not sure what the policy is everywhere else, but I would definitely encourage you to talk over with your supervisor before you go ahead and just start a group program. Okay. So,
Melissa, if I could add, this is Casey. I just wanted to add that, you know, the Vermont Department of Health and the CDC and the Minnesota Department of Health, they're putting out guidelines for, you know, opening restaurants or opening bars or starting school. And their focus is on preventing outbreaks and it's a public health focus, where the goal is to prevent large numbers of cases, large numbers of deaths, and to prevent an outbreak. Our goal at SASH is a little bit different from that, and not in conflict with that in any way, but it's a little bit different in that we are trying to protect individual high-risk people. So even as we start to offer some of these groups, there are certainly some of our participants who should be consulting with their primary care about what is the risks to them, and should they be going to the indoor group programming or even the outdoor group programming? Should they be going anywhere? And that's a very individualized decision, but that they should be consulting with their own doctor about what's best for them in these cases, because what's best for the group and from a public health standpoint, that I think that's a little confusing to folks, that it's okay for older people to congregate as long as they wear masks and stay 6 feet apart. That will prevent outbreaks in congregate settings, but it's not necessarily going to prevent one individual from getting sick and potentially very sick or even dying. So we need to keep very clear with that message that people should be consulting their primary care.
Yes, thank you, Casey. That's really helpful. So a couple more chats have come in. I want to get to those. Paul asked if Kenneth can talk more about having a second person. So a little earlier, I missed this chat. Thank you, Paul. Kenneth mentioned that they found that having a second person around to help during programming is key. Paul, I don't know if you want to be unmuted, or Kenneth, I don't know if you want to be unmuted and actually talk about what you found there, or if you want to include it in the chat. Either work for me. Oh, it looks like you've got some chat. Volunteer who can screen, queue, and help focus the new people coming in on protocols. Some places are hard to keep passerbys from entering without following a protocol. That's great feedback. Thank you, Kenneth. And then Jody Velarde just asked around when I said you would want to consult with your supervisor. Jody, I guess I would mean around the housing, but certainly, you know, before you do a group program, you probably want to check in with your wellness nursing supervisor to make sure that that's okay based on their protocols as well. Okay, so wonderful conversation. Thank you guys. I'm going to move us along, but please keep chatting them in and we'll just keep bringing them up as you do. I want to give a big thank you to April Menser, a SASH coordinator at Cathedral Square Senior Living. She developed a program that she's working through with her participants to help guide the process of preparing for a potential second wave of COVID. And I believe this is on STAR. If it's not already, we can definitely add it, but it is going to also be highlighted in the newsletter that comes out from COVE, which is very exciting. And this is a different kind of group work that April's doing with her participants, and I believe that she's doing it through her Flash, but I could be wrong. And the idea is it can be pretty daunting to just think about a second wave or needing to quarantine and isolate again. And I know it's daunting for me to think about, so it could definitely be daunting for our participants as well. And in just the perfect SASH mindset, April decided that the best thing to do when you're facing a daunting task is to break it down into smaller, somewhat less daunting tasks. So that's what she's done here. And I also know that you've added a couple steps to this, April, since I created this slide. So there could be up to, I think, 7 steps now on the document that April created. But we've got, oh, perfect, thank you. You've published it weekly in your newsletter. Great. And so there's guidance around inventorying food, making sure that you're stocked up on non-perishable and freezable items, inventorying your medicine cabinet, making sure that you have a thermometer on hand and you have a good supply of over-the-counter medications, as well as your prescription medications, possibly even looking into a 90-day supply of medications. Step 3 is taking an inventory of your cleaning supplies and paper goods. Are your disinfectants running low? What about toilet paper and tissues? Step 4, do you have difficulty getting items while you were staying home? Did you need help with grocery shopping or other errand running? How did you get that done and how would you do it again? Step 5, how did you meet your needs for social connection? Were you lonely the last time you had to isolate? What would help you not feel lonely if you had to do so again? And then April, I don't know if you want to chat in your other steps that I have missed, but feel free to. And again, this is something that we can put up on STAR if it's not there already, and people can feel free to use it with your participants as well if you'd like. Thank you for sharing it, April. I appreciate it. Casey, I think you wanted to talk about how to hug.
Sure. So I wanted to share this. I know that in general, that we are trying to keep people separate, and a lot of our participants were working hard to get them to not gather as much. But we do have some participants, I'm sure, at every panel who are really isolating themselves and perhaps, for example, have not hugged their grandchild since February. So there is some guidance out on how to hug during a pandemic. This mostly came from the New York Times. Dr. Osterholm, who I've been following, also talks about how to safely hug and the importance of hugging. And I think for some of our participants, this might be really, really important for them. I know for my own parents, getting to do a 10-second hug was mind-blowing for them. They just really needed that. And they hadn't hugged their grandchildren in over 6 months, and so it was important. So this might be something that we can share with some of those people that really need that. And so the importance. Sorry, I'm going to have to pause for a minute.
No worries, Casey. It happens to all of us. I think what you're going to say is the importance is really just to kind of keep facing away from each other. Is that probably where you wanted to pick up? Oh, Molly, her dogs wanted a hug. I love it. Okay. So keep hugs short, 10 to 30 seconds. Don't talk or cry. Face away from each other. Don't touch cheeks or masks. Skip casual hugs and save hugs for close family and friends. And there is this New York Times article on the bottom that talks about it. Oh, and while we're waiting for Casey, I think April did chime in on the chat about the rest of the program that she put together. That's wonderful, April. Thank you so much. And we will make sure that we get that onto STAR if it looks like it's not already. So we will definitely add that. Kim is printing out this page to hang in her buildings about how to hug. I love it. Okay, well, we can definitely get you a clean copy too, Kim.
Yeah, I was just gonna say, Melissa, this is Amy, that we can put a clean image of this and put it on STAR for people to post in their buildings.
Perfect. Thanks, Amy. Okay, so the next is health check-in ideas for SASH coordinators. We had a couple SASH coordinators reach out and just ask if there's things that they should be talking about with people and their health. You know, you're not nurses, but you can still ask some questions, and they just wanted to know sort of what kind of things would be appropriate for them to ask. So basically, Casey came up with the following, which is just asking, you know, how is your health? A lot of people are putting off health concerns right now. Is there anything bothering you that you haven't talked to your doctor about? Are you having any difficulty getting your medications or getting an appointment to see your doctor? And how has your health changed over the past few months? So I think those would give you some really great feedback that you could possibly then act on, either by helping people call their doctor or sharing with the wellness nurse. But you're not going to get such clinical information that you're not going to know how to help them. And this was just a question that someone came up with that we thought we would talk about here. The next thing, and Casey, just chime in when you get back. So,
I'm back. I think my dog's supposed to be quiet now.
Mine will probably start barking, so we're fine.
I wanted to share some of this data from the CDC. I think this is stuff you guys all know. It's definitely, we've been hearing it from you about mental health. and how much your folks are struggling right now. But it was a little shocking to me to actually see some of these statistics, that the anxiety has gone up 3 times the amount from 2019, depression symptoms 4 times greater than 2019. 1 in 10 people who completed these surveys for the CDC report starting or increasing the use of substances. Suicidal ideation is 2 times higher than 2018 data. And I think this last one was really eye-opening for me, that 30% of unpaid caregivers for adults report serious consideration of suicide in the past 30 days. And that one really stands out. I know we've been reaching out to our participants, but we want to make sure we're checking in with those caregivers as well, checking in with the adult children who are caring for their parents or for spouses. And we've been heard and we've talked some about the increased risk of abuse as well. So checking in with those folks, what do they need? How are they doing? I think is super important right now, especially as we're going into the winter, where a lot of people feel alone and isolated even without COVID. And then the next slide.
I just wanted to say thank you for pointing that out. I'm actually headed from this meeting to a suicide prevention meeting in Franklin County, and I'm going to be bringing that with me. I think that's a statistic that we all need to spread far and wide. I genuinely had not considered that before reading this slide, and I think it's very telling. It makes a ton of sense, and I just want to spread that word as much as possible so that we can all be reaching out to those unpaid caregivers that we know, just to see how they're doing and maybe talk to them about resources that are available.
Right. Thanks, Melissa. You just cut it out.
Sorry.
So, so this was taken from Dr. Osterholm around his talk on mental health, and kind of that there were kind of 4 buckets to really address right now. And this speaks a lot to some of April Mentzer's information too. But the 4 buckets that he was talking about are fear, exhaustion, loneliness, and hope. And his podcast is free and available to anyone. Though this is from the last one on specifically on mental health. But there's definitely a huge amount of fear around this virus. There's also a lot of division caused by this virus, division between friends, between family members. The knowledge that we can share with our participants is what can help address that fear. And that's something we can give to people, is just keep giving them tools and giving them information. You know, is it safe to go to the grocery store? How can I make it safer? Is it safe to go to the doctor? That kind of thing. Exhaustion, we're certainly seeing a lot of COVID fatigue. I'm feeling some COVID fatigue. Burnout is, you know, how many times do we call the same person and have the same conversation on the phone? These are real issues. There are also issues for our participants that they just get tired of wearing a mask or tired of having to deal with some of this. So, but we can't give up, and it's certainly going to get worse in that it's definitely going to get colder and it's definitely going to get darker. We know that. We don't know if COVID's going to get worse or the cases in Vermont and Minnesota are going to get worse, but we do know it's going to get cold and dark. So that's going to contribute. So we need to find new ways. And some of the things that April was talking about is, you know, is there a new hobby? Is there something you've wanted to learn? Is there a, you know, Netflix shows to watch? Those are things she put in the chat there. Finding a new hobby, something new to reinvigorate and give yourself more energy, and for our participants to try something new. You need to find ways to exercise, and a lot of that can be virtual or it can be on your own, but sharing those ideas with participants. Dr. Osterholm talked about loneliness as the cruelest of all. We've certainly talked about that a lot on these calls, and how terribly it affects health, physical health and mental health. We need to find ways to connect safely. That's where the hugging piece can come in. Also talked about creating safe pods, and I know some of the nurses, Todd and Sarah, have talked about this some with their participants about trying to find and create a small group of people that you have a contract to stay safe, and they become up like your small family, so that you have someone you can connect with and talk with. Finding ways to connect with family, whether that's by Zoom or outside, especially while it's still nice out, and trying to maintain hope, hold each other up, highlight the community, highlight what we have for connections, and really be there for each other. I didn't see if there were any chats in on that, any of that.
Nope, you're all set. Thanks,
okay,
Kate.
we can go to the next slide.
Sure. So we just had some updates that we wanted to share with you all. Please, if you're able to, enter email addresses collected on the COVID individual plans into PHL. You do that on the client demographics page. And with all of the work that we're doing right now to look into and focus on telehealth, having those email addresses would be really helpful. Also, please, if you have already asked the race question, but it didn't get entered into PHL, please go back and enter those. That also would be very helpful to know right now. We are asking that you please focus on assisting with telehealth appointments where you can. I know we had Gretchen on the call in August, and she did a great job talking about how she's been working with people on telehealth. If you have any questions about telehealth, please let us know, and we are working on some trainings that we can hopefully share with you that will help with assisting with telehealth appointments. Don't forget that we have a step challenge occurring from September 13th to October 10th, and you have 2 chances to win a gift card and it'll help you increase your daily steps. So don't forget about that. And then we have a foot care webinar coming up Tuesday, September 22nd, which is tomorrow at 1 p.m. And we've got some presenters that are going to be on that call. So, oh, I'm sorry, there's a question coming in. Can we add a line in the SASH assessment for email? Oh, absolutely. We can definitely do that. The next assessment update isn't done until the very 1st of November, but we will add that on the list to add at that point. Thanks, April. That's a great idea. Okay.
Can I add one more update to this?
Please
Melissa?
do, yeah.
So just a reminder to everyone that the next time we have this COVID webinar, it will be on Zoom. So you will be getting a cancellation from GoToTraining of your registration for these webinars, not just the COVID one, but also the SASH coordinator one and others that are ongoing, with a link to register for the Zoom webinar. So starting in October, all SASH webinars will be on Zoom, just FYI.
Thank you, Amy. Great reminder. I logged on a little early to this call today, and I was the first one here, and I thought, oh no, did it already switch to Zoom? Am I on the wrong place? So I sent out a couple frantic emails, but then people joined and I was all set. Okay, screenshot. So now through the end of October, Casey, did you want to take the slide, or were your dogs barking? It's totally up to you.
I think they are quiet at the moment. I just wanted, there was some questions about the foot care webinar, which is tomorrow for the wellness nurses, and it is a not necessary. It's for all the nurses, and it can and it is about how to look at feet and the importance of foot care. It is not necessary, and it is going to cover some of the techniques, but it's for because all of our nurses should be knowledgeable about feet and how to look at feet and when to refer somebody to a podiatrist. So even if you are not a nurse or your nurses are not actually trimming toenails, they should still go to this webinar to learn more about just how to look at feet for general wellness, and how to and when to make a referral and how to handle that. So I know Molly wanted to say something. Should I pause so she can be unmuted and add something?
Oh, please do. Yeah, there must have been chat. Yes.
Yeah, that would be great. Can you guys hear me?
We can. Hi, Molly.
Oh, wonderful. Hi, everyone. I just wanted to take a second because one of the slides a couple back had put out the reminder and the request to please add race into PHL, ask that of your participants and get that into the system. And I know that when we brought this up a couple months ago, there were a number of questions and concerns asked about that. And I just wanted to, because I'm in the middle of writing a grant application, I wanted to bring this up because we're trying to get funding to help if we do end up getting technology, tablets, et cetera, to get out to SASH panels across the state, which we are attempting to do. We're looking to get a grant to help us kind of build the system and the training to be able to get those tablets and technology to you all to help your participants with either telehealth or social connectedness, et cetera. But the grant that I'm applying for, the organization is called Enterprise Community and Community Partners, and one of their main focus areas is on supporting programs and projects that are supporting traditionally marginalized people in communities. And so throughout this grant application, they're looking for data on the ethnic and racial makeup of the people we serve. And so not having accurate data or really much data at all on that has been very challenging. So I just wanted to throw that out there as a very pragmatic reason to collect this data around race and ethnicity on our participants. If we don't know what the makeup is of our participants, then one of the possible repercussions is that foundations and grantors who really are trying to make a difference for those communities are not going to consider really positively our applications. I'm hopeful that I'll get around that, but I just wanted to give you an example. So thank you.
Thank you, Molly. And also I wanted to just add that Jen chimed in, and thank you, Jen, I completely forgot. We have actually already added a line for emails in the SASH assessment. So if you aren't seeing it on your paper copy, you might not have the most up-to-date one, and that can be found on STAR. Oh, so it's not in the wellness nurse assessment, but it is on the SASH coordinator and the full assessment. Perfect. Thank you for that clarification. And Kenneth is asking if there will be a question at some point regarding sexual minorities as well. And yes, Kenneth, we are actually working on that. It is in the pipeline of things that we are just working with wording on. We have something on gender, but we don't have anything on orientation. So we are working on that as well. And any feedback, I would love any kind of input on the resources that we could look into. We just want to make sure that we're wording everything appropriately. Sorry, back to flu shots.
Yes. So this is the time to get flu shots. So now through the end of October is the best time to get a flu shot. Definitely encourage sites to try to set up clinics or to reach out to local agencies and find out what's going on in your area. A quick search this morning, I found that Central Vermont Home Health and Hospice, there's a whole bunch of clinics set up in the Barre Montpelier area. I'm sure that they are happening all over the state. But we certainly have people who can't get to those or are worried about going to those. So trying to bring them to your site when that's possible. And some places to reach out to, you can reach out to your local home health agency. They may be willing to come to your site, connect with local pharmacists. They're often the ones who are coming to sites. And then talk to your SASH team about who's offering flu clinics in the area and what the resources are for your participants. A lot of the typical clinics may not be happening. So like they used to come to the meal sites, and since meal sites are not open in most places, that might not be happening there. I know Dartmouth Hitchcock usually had just kind of a walk-in. You just come whenever you want to, but this year you have to schedule, and they're basically, you have to stay in your car. So things are definitely going to be very different this year. So start working on that now and find ways, places you can refer if you don't have something set up for your sites directly. And certainly be thinking about how you will get your own flu shots for your family. There is a nasal version of the vaccine this year, which hopefully will help encourage more kids to get vaccinated. Though I don't know about availability and whether pediatric offices will have that. So be thinking about that. A lot of employers are also not doing the same flu shot clinics the same way. So this is the time to start working hard on that.
Thanks, Casey. There's been a lot of coming in. And basically what it is Annie McCormick had the experience where at the last minute, Hannaford told her that they weren't going to be able to come in because they had gotten guidance that they couldn't come into a community living setting. And so they were going to cancel after having been scheduled for a month and a half, but they were able to move it next door to the senior center. So they were able to do it. And then lots of people chatting in about them having people confirmed to come. So just might want to reach out. I think it'd be great if we could follow up with that, Annie, and find out where they received the guidance telling them that they couldn't, to make sure that it's not some new thing that's come out that's going to put all the rest of these that have also scheduled stuff at risk. And then I think most of that was just about that. Kenneth shared a resource that we can look into for our sexual orientation question, and then the rest was just about people having flu clinics set up, which is fantastic. I don't think I've missed anything else. And then just the quote of the week, I've got, this is Dr. Fauci again on the Vermont press conference. If everyone cooperates by wearing a mask, keeping a 6-foot distance from others, avoiding crowds, and washing hands frequently, Vermont and the US can not only get through the fall and winter, but we can come out on the other end of it better off than we went in. That seemed very encouraging to me. So I'm just going to choose to believe that that's going to happen and do all those things and do my part to try and make sure that that does happen. We will be having 2 calls. We are back to the every other week call, so it will be on October 5th and October 19th. We just missed the 1 call because of Labor Day. So we're hoping that on 1 or both of those calls, we can highlight some work that Dory, our Med Fellow, has done on social isolation, and we will keep you posted if that can happen. So thank you all so much for joining us, and we do have a few extra minutes, so I'll hang out if anyone has any questions. Otherwise, have a wonderful day. Thank you all, and happy Monday.